The theme of the second series is lower back pain. I'd like to give lectures about clinical practice from now on. First of all, I'd like to explain the practical basic knowledge for treating lower back pain. There's a lot of knowledge about lower back pain, but the important thing is what kind of knowledge is actually useful. It's true that all of them are necessary. However, there's some real basic knowledge that we must understand in particular. I'll lecture you about it during this second series. I guarantee that it'll be absolutely useful in your clinical practice. In this second series, you'll find very interesting things. You may have the impression that lower back pain is extremely complicated and difficult to treat. Actually, I thought so too. It's certainly not easy. But you'll find that lower back pain isn't as difficult as you think. If you cover all of the second series and follow the right process, you'll be able to deal with lower back pain in clinical practice. I think you'll find that lower back pain isn't as difficult as you thought it would be. I guess most therapists, when they treat a patient with lower back pain, just tend to warm their backs by thermotherapy, have them to do sit-ups and back extensions, or core control exercises. But please think about it. Did you really make patient get better by doing that? Actually, there aren't so many clinics in the world that are said to be able to improve lower back pain. However, once you understand the content of the second series that I'll talk about this time, I'm sure you'll find that you can deal with it clinically. I think you can really get that feeling. So, please look forward to this second series. Now, I'm going to talk about the true nature of lower back pain as the first session of this second series. Clinical reasoning. I always use this slide to explain clinical reasoning when I give lectures. You may think that clinical reasoning is very complicated as it sounds academic. However, as I talked about in the first series, this is exactly a repetition of hypothesis verification. Namely, I think this is exactly clinical reasoning. And what is important in clinical reasoning is to conduct histological reasoning first. I explained this in the first series. For example, in the case of lower back pain, there's a tissue that's causing it, right? So we need to identify what tissue is causing the pain. We have to properly assess and treat it. For example, it's not a good idea to provide routine treatments just because the patient complains of pain when bending backward. We need to identify and treat the tissues that cause pain when the patient bends backward. This concept is absolutely necessary. And biomechanical reasoning. There are things to think about after we conduct histological reasoning. As I mentioned in the first series, we must focus on the causes of histological problems. For example, if your body is bent like this, there'll be distortion and strain somewhere in your body. Therefore, it's always necessary to make mechanical reasoning about what's creating the stress on the tissue that's causing the pain. I'd like you to know that it's very important to understand this point first. You must be watching this lecture because you want to make your patients better and relieve their pain in clinical practice. In this lower back pain series, I promise to share my knowledge and techniques with you in order to respond to your enthusiasm. In these 6-part lectures on lower back pain, I'm going to focus on what you need to know about treating lower back pain. Especially for young therapists, I think the contents will be useful for the rest of your careers, so please listen to these 6-part lectures carefully. I believe that if you learn well, you'll definitely realize that knowing the knowledge and techniques from this series is certainly a great asset. To begin with, what's the current status of lower back pain treatment in Japan? I'd like to talk about this. For example, if we take 10,000 middle-aged and older people who had no lower back pain at all, here is an interesting fact. This time, let's define middle-aged and elderly people as people over 65 years old. What would happen if we performed X-rays and MRIs on 10,000 people over the age of 65? Probably almost all of them have herniated discs, and their spinal canals are narrow. In everyone over the age of 70, the spinal canal becomes narrower. Also, they have compression fractures. The underlying history of compression fractures varies. It may be caused by a fall, or it may occur without you even realizing it. Additionally, their vertebral bodies have deformities. I think there are very few people who don't have vertebral body deformities. Finally, disc degeneration. This is exactly what happens to everyone. I believe there's no one who doesn't have disc degeneration. In this way, medical imaging tests generally detect structural abnormalities. For example, let's say a man with these age-related changes started having lower back pain a month ago. If the pain doesn't go away, I think he'll go to the hospital. When he goes to the hospital, he'll have imaging tests first, right? And then, of course, these findings such as herniated disc, spinal canal stenosis, compression fracture, vertebral body deformity, and disc degeneration will definitely be detected by the tests. It's because they've been there originally. This is a very important point I really want to highlight. As a result, he'll be diagnosed that his lower back pain comes from them. I think this is the normal process by which a diagnosis is given to a patient who comes to the hospital with lower back pain. When thinking about lower back pain, I believe two things are always important. What do you think they are? As I indicated earlier, older people, especially those over the age of 70, they all have abnormal findings on imaging tests. Does that make sense? Whether they have lower back pain or not, their image findings are originally abnormal. This is the first point. And the real causes of many lower back pains can't be seen on imaging tests. In other words, imaging tests can't exactly identify the area causing the pain. This is crucial. I mean, it's difficult to determine which part of the body is causing pain through imaging tests. And more importantly, 90% of treatments for lower back pain, other than surgery, are the same ways. This is something that I really understand now that I have my own physio center. For example, I always ask a new patient, "What kind of treatment have you received at the hospital?" And then the most common answer is, "I'm told to take some medicine and see how it goes." And the next most common is, "Let's undergo rehabilitation and see how it goes." However, even though it's called rehabilitation, I think it's pretty decent if it's done by a physical therapist. In many cases with lower back pain, only thermotherapy, electrotherapy, and traction therapy are provided. I think you'd agree that these are the main treatments for patients with lower back pain. I'm not criticizing this situation. Since I opened my own physio center, when I ask my patients what kind of treatment they have been receiving, the most common answer is this. But please think about it. Are there lower back pain treatments based on any kind of hypothesis testing? Through imaging tests, they are diagnosed with a herniated disc and are treated with medication, electrical therapy, massage, or traction therapy. In fact, there's no hypothesis testing through this process. Important things are shown in this diagram. This point is often mentioned that 85% of lower back pain is non-specific low back pain. It means that we don't know what it is. This is why it's called non-specific low back pain. Generally speaking, 85% of all lower back pain is non-specific low back pain. In other words, the actual condition of many cases of lower back pain isn't well understood. Moreover, as I said at the beginning, we don't know if the imaging tests are identifying the cause of the pain. This is because all elderly people show some abnormal findings on imaging tests. However, even among them, some have pain, some don't. So, even if you're not a physical therapist, considering this fact, you won't think that imaging test findings can identify the source of pain. This is a very important point that I want everyone to know. Furthermore, there's something more important. Spinal canal stenosis and herniated disc are known as the most common lower back pain conditions, but basically they don't mainly cause lower back pain. Of course, they can have lower back pain, but actually it's not the main symptom of them. Their main symptom is leg pain. It means that the main symptom of spinal canal stenosis and herniated disc is leg pain. With that in mind, let's look at this figure again. As you can see, 85% are occupied by cases with non-specific low back pain. However, spinal canal stenosis and herniated disc, which accounts for 10% of cases, are not lower back pain conditions, except in the acute phase. They mainly cause leg pain. In other words, 95% are non-specific low back pain cases. Do you understand what this means? Non-specific low back pain means that it's not well understood. Of course, specialists are more likely to be able to diagnose accurately, so the ratio of diagnoses may vary depending on each doctor. However, as shown here, most lower back pain can't be diagnosed only by imaging tests. Therefore, it's important to note that some conditions, which can be clearly diagnosed through imaging tests, can't actually be said to be the cause of lower back pain. Now, I'd like to introduce that Dr. Takaya Narita, whom I often refer to, clearly categorized non-specific low back pain. He categorized non-specific low back pain as follows. First, intervertebral joint pain. Second, sacroiliac joint pain. Third, discogenic pain. And finally, myofascial pain. I think most cases of non-specific low back pain are included in this category. As I said before, the main symptom of spinal canal stenosis and herniated disc, which can be identified on imaging tests, is mainly leg pain, so you can understand that. Most lower back pain can be categorized into these four. I guess the most common is probably intervertebral lower back pain. Thus, I think you found out that these four are the majority of the parts that can cause lower back pain. You may have thought that lower back pain was very difficult to deal with, but if you understand that, you'll think you can treat it yourself. This is because if you master the evaluation and treatment of these four causative parts, I think you'll feel more confident that you can deal with lower back pain. This is the important part, and if you repeat clinical practice on this categorization, I believe you'll find that most cases with lower back pain can be categorized into these four categories yourself. When I first learned about this, I actually tried according to this, and I found out that most lower back pain falls into these four. This is important. And now, you'll notice something more important. In fact, surprisingly, all these types of lower back pain, which come from intervertebral joint, sacroiliac joint, intervertebral disc, and myofascia, can't be detected on imaging tests. Don't you think this is very important? Once you understand this, you'll realize that the most important part of lower back pain treatment is the right process of assessment to clarify the target to treat. Of course, I don't mean that you don't need findings on imaging tests, because there are certain things that can only be seen on them. If you treat cases with lower back pain based on right targets, you'll find that most of them will get better. How was the content of this lecture? Don't you think you've discovered some surprising facts? As you go through this online lectures, I think you'll gain more and more confidence in your clinical practice. By understanding the contents in this series, I'm sure you'll be able to assess patients correctly and come up with ideas to treat them properly. In the upcoming lectures, I'd like to explain in more detail the points I introduced this time. In the next lecture, I'll talk about interview for lower back pain. Interview is very important. You shouldn't underestimate the importance of interview. If you can master interview, you'll be able to understand the condition of lower back pain to some extent. This is essential. I'll be sure to tell you all about it. Please look forward to the next lecture.